Okay, so in the previous video, we went ahead and prepared our morphine for intramuscular injection. We had an order to administer now, which is within a 90-minute time frame. So once we enter the patient's room, we're going to go ahead and do some hand hygiene, ensure privacy for the patient, and kind of introduce myself, explain what we're going to be doing today. And then I'll be asking for 2 identifiers to ensure I have the right patient. So normally that's name and date of birth. I'm going to go ahead and go over to the MAR, double check to see the medication that we're administering, and I'm also going to match that with what he has on his bracelet. So that'll be the 3rd time that I've completed that action. The 2 previous times were once I received the order and once I prepared the medication. And then also too, I'm going to ask my patient if he has any allergies for any types of medications. So once I've verified the right medication in the MAR, I'm going to go ahead and go over to my patient. I'm going to find a site of insertion, so I'm going to go ahead and remove some bedding. All right, I'm going to be administering intramuscularly, so it'll be in the vastus lateralis muscle, which is on the thigh. So the landmarks that I'm going to be using is the greater trochanter and the knee. I'm going to use one hand to go below the greater trochanter and then one hand above the knee. For the insertion site, it'll be an area in the middle third of the muscle on the vastus lateralis to the anterior lateral side. Okay, so once I found a site for insertion, I'm going to go ahead and don some gloves. I'm going to grab an antimicrobial wipe. I'm going to go ahead and clean the area to be inserted. And when I inspected his leg, I looked for any abnormalities, adequate muscle tone for the insertion, and also for lesions or any other things like that. Okay, so once the area is clean, I'm going to go ahead and prepare for the injection of morphine. So I'm going to use the Z-Track method, which is I'm going to take my hand like this and about 1.5 inches away from the actual site of the injection. And then I'm going to hold the syringe and needle like a dart with the pointer finger and the thumb of my dominant hand. I'm going to advise the patient I'm going to be doing the injection. Go ahead and relax the muscle. I'm going to go ahead and inject now. And with the non-dominant hand, I'm going to use the forefinger and the thumb to hold the needle stable. And I'll be injecting the morphine, 1 milliliter for 10 seconds. 5, 6, 7, 8, 9, 10. Hold it there for additional 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1. I'm going to immediately release it, and at the same time, apply a cotton ball. I'm going to secure the needle with the guard, and then place the needle into a sharps container. Once I'm done applying pressure, I'm going to go ahead and apply a Band-Aid. So once I'm done applying the Band-Aid, I'm going to go ahead and get the patient back comfortable again. I'm going to go ahead and gather up all my supplies, properly dispose of them. I'm going to go ahead and doff my gloves. I'm going to do some hand hygiene. And I'm going to go ahead to the medication administration record. I'm going to go ahead and document the dose, the date, the time, the route, the agent. Also too, any possible outcomes, and most importantly, the site of injection. Once I'm done annotating what occurred, I'm going to go ahead and give the patient some education. So in this case, since the medication was administered into the vastus lateralis, it could get a little sore, so actively move the leg, keep the blood flow moving. And then once I'm done, I'm going to go ahead and leave the room, and that is it.